Hi, this is Dr. Robert Antolak from theGentlDentist.com in Shelby Township, Michigan. And something that people are very, very common of having when they come to the office is a history of either headaches, migraines, tension headaches, or pain even in the muscles of the jaw here. These are significant numbers of people. I find mostly women have these issues, but men also do too. So many times it's from usually a stressful life, and during your sleep process, when you're sleeping, it's your body has the ability, going through different cycles of sleep, to do different things. And so one of the processes that sometimes people do is to bite down and clench their teeth really hard, like that, or grind their teeth from side to side, like side to side. You know, if you have a loved one, you're hearing him or her doing these things, then it's something that should be done to get something to prevent the tooth wear and the headaches that can take place from grinding of the teeth. So I want to just discuss the difference of treatment protocols that have been used in the past for the grinding of the teeth. What's most commonly used is a full coverage mouth guard that would look something like this. It's plastic, it's clear, okay, and it goes basically over the teeth. It goes over all the teeth, and it snaps over it. Creates a flat plane on the bottom here, so then people still can kind of grind. What they do is they don't wear their teeth down as much when they do this. So we do use this. We use this with patients who, for certain situations, usually if it's somebody who just kind of is wearing their teeth down, but they don't have any other symptoms at all. They don't have any headaches, they don't have any jaw aches, they don't have any clicking or popping in their jaw joint. So they don't have issues like that, but we just want to protect their teeth. But the majority of the time what we do is we use something called the NTI. It's a small little device that it only goes on the front teeth. It's pretty darn small, and I'll just use my hand as a backdrop. And so what this does is you can see the size of it. It's pretty darn small compared to the full coverage guard. So it only goes from eye tooth to eye tooth in the front. The reason why this is effective is that it's got this little device, this front part, where when you bite down, you only bite down your front tooth here. And so if you try to squeeze, you can try yourself at home, putting your hands up to your temple area, and if you bite and squeeze on your back teeth, you'll notice that there's bulging in these muscles here and bulging in these muscles here. These muscles are the muscles responsible for chewing of your food. Okay? If you put a pencil in between your front teeth, which is the same type of thing that this small little device does, what you'll find out is that you can't bite down as hard. In fact, you can only put about maybe 20% of the biting force only biting on your front teeth than you can on biting your back teeth. So that's how God made us. And so now we want to take advantage of that for people who clench their teeth. And so now when they wear this type of device in their mouth, what happens is that because there's less pressure that they form in their temporalis muscles or in these muscles here, your cheek muscles, and clenching, and there's much less pressure. That pressure is reduced. That means there's less stress, and your resultant is reduced headaches. We find many times people who start using this, their headaches are significantly reduced because the tension that's formed from this muscle activity over the night, it can get so big and exacerbate so much that it leads to tension headaches and even can lead to migraine headaches. So it's a great way without using medications to reduce the tension headaches that can so commonly happen from stressful work, kids, or whatever the situation is. It also helps to save the wear and tear that takes place on teeth when nothing's worn down. Many times we'll find patients who have this problem with grinding is their teeth are worn down, and there's actually pads. When the teeth are moved from side to side, you can see the wear patterns on the natural teeth. Unfortunately, you can't do anything about these wear patterns except stop them from progressing and getting worse. There are some things to be done restorative-wise, what we do, but it can be pretty costly. The best way is to prevent it from happening in the beginning, reduce your headaches that you're having. Something like this is around $350 for that, and compared to much more, which these full coverage guards are. and it will save you a lot in the long run. You'll get a decent night's sleep, and you'll not have to worry about missing work because of the headaches that you might have. If this is something that is of interest to you and you know that you do have problems with this, then give us a call. Our phone number is 586-247-3500, or our website's thegeneraldentist.com. Thank you.